Windsor-Essex Children's Aid Society is excited to launch an innovative podcast titled Inspiring Community. The Society is very aware of the diverse, multifaceted elements of our community that come together to support children, youth, and families as they celebrate success and rise to overcome significant financial, social, and mental health challenges. Hosts Mike Clark, Manager of Public Relations and Fund Development, and Tina Allen, Manager of Community Outreach, will be reaching out to many of the Society's community partners and resource organizations to provide insight and helpful suggestions to help overcome these obstacles. The goal will be to provide a practical toolkit for listeners on topics such as managing parenting issues, financial strain, self-care, strengthening relationships, and so much more. The hope is that by talking with community experts, listeners feel more connected within a community of support. Join us as we look at new ways to reach for a better tomorrow.
Welcome, everyone, to Inspiring Community, a podcast of the Windsor-Essex Children's Aid Society. And joining us today is Kim Willis, Director of Communications and Mental Health Promotion at the Canadian Mental Health Association of Windsor and Essex County. Hi, Kim.
Good afternoon.
Welcome. Kim, why don't we start with you telling us a bit more about yourself and your role at CMHA?
Sure. So as you said, I'm the Director of Communications and Mental Health Promotion. I've been here now about 11 and a half years and have seen some exciting growth happen throughout the organization during that time. So I started off doing the fundraising and communication and volunteer management, and then we became more proactive in mental health promotion and our outreach initiatives. So we launched our Soul Focus campaign in 2017 and have grown that team immensely as well. And now we also have a Wellness and Recovery College, and we're part of the Youth Wellness Hub under my portfolio as well. So it's been an adventure, never a dull moment, but lots of exciting things and really, more avenues for the public and the community to access services.
Mm-hmm. And you have a new CEO, Nicole Sabraka. Can you share with our listeners her background and when she started? She just started.
She just started. So I think she's been here about 6 weeks now. Wow. So we are very excited to have her. She was actually on our board for a number of years. So that's nice that she's familiar with the organization and who we are and some of the things we do. And prior to coming to CMHA, she was the manager of the cancer program at Windsor Regional Hospital. So very, I think, very visionary and, very smart. And she's going to be responsible for a lot of things, but also including our new strategic plan and operationalizing that and helping us realize some of the objectives and goals that are part of that, the plan.
All right. Thank you.
Kim, it's great to be with you today.
Thanks.
CMHA goes back quite a while in our community. I even remember when it used to be on Aletta Avenue.
Wow.
So can you tell us a little bit about how maybe that evolved in the programs and the services that CMHA upholds in Windsor-Essex?
Yeah, so we celebrated our 50th anniversary a couple of years ago. So we have been part of the community for over 5 decades. We started out of a basement. I know our bereavement program, which is one of our longest standing programs and, very reputable, and we're very proud of that, came about when a tornado happened and people were looking for some grief supports. And so we've grown that program a lot over those 5 decades. And we really serve those individuals and families experiencing the more moderate to severe mental illness. So, we're not so much the go-to for those experiencing more mild symptoms, but we have over 20 programs and services, mainly for those aged 18 and over. We have a couple exceptions to that. We do have GriefWorks for children and youth experiencing the loss of a loved one, and early intervention, which is around first episode psychosis, starts at age 14. And then, as I mentioned, we have our Youth Wellness Hub, which is for those 12 to 25. But I think I've seen a lot of growth and expansion of our services that really are prompted by what the community is experiencing and what the needs are. So, we're one of the few CMHAs to have a community health center directly on site, which is pretty amazing. It allows us to address individuals really holistically because we have the mental health services as well as the physical health care services. We instituted a Safe Beds program a couple of years ago for those involved in the justice system and needing to go somewhere with some supports when they're released from custody. We've also, like I said, really grown and evolved our mental health promotion and education services, which was a response to the community feedback we received when we did our last strategic plan. And that's grown a lot. So I think as an organization, we're very community minded. We're the lead provider of specialized community mental health services in Windsor and Essex. And we do our best with the resources we have to respond to what we're seeing is needed in the community.
Yeah, and that's probably a really good lead in to the next question. These are very complicated times. Mm-hmm. So we know that the mental health needs of children, youth, and adults continue to grow and are even more complex than they ever were. Can you share with us the issues and trends that you are seeing among those struggling with mental health, particularly in the adult population?
Yeah, and I think you hit it spot on. It's the complexity that individuals are coming to us with a myriad of issues, and it's not one size fits all. That we oftentimes have to involve multiple providers or caregivers, and we're just seeing that increasingly. And the Youth Hub, it's funny, when we first, went down that path of establishing the Youth Wellness Hub, and you're thinking, okay, yeah, our youth need a place just to connect, and maybe they're experiencing stress and anxiety as it relates to school or relationships, and that very much is the case. However, we are seeing, weapons come into the conversation, a lot of, self-harm increasingly, like just things you wouldn't have thought of going back 5, 10, 15 years ago that are becoming a lot more commonplace. So I'd certainly say the complexity. And then the number of individuals needing or wanting to access mental health and addiction services. I know some of our programs are up 50% from previous years. And, we don't get extra bodies to, meet those needs. So I think just coming out of the pandemic and just the state of global affairs and, the daily realities we're all faced with right now with a lot of financial pressures, housing, that those numbers are really increasing. And I would also say the addictions piece, that we're seeing more and more individuals that have a mental health issue, and they may also have the addiction issue that they're using as a coping mechanism. But, that can be quite dangerous as well. We're hearing about more overdoses. So I would say those are the three main things: the complexity, the volumes, and then adding in the addictions piece.
When it comes to accessing your services, is this, are there different streams of access? Do you work with community partners that refer families, or can they just show up at the door? And it's sort of that no wrong door?
We try that. That's really much our goal, is that, you shouldn't have to make numerous calls and be, go from one provider to the next. So we are a close partner of Hotel Dieu Grace Healthcare, and through that collaboration, we have what we call coordinated access. So you would call one number, and they would, hear what you're experiencing, what the needs are, and either then direct you to an appropriate CMHA service, or if we're not the appropriate provider, then they would link you with, who is available in the community to help you. So you can go that route. You can walk in our door at the Youth Wellness Hub, again, low barrier. is the goal. So you can just walk in there Monday to Friday from 1 till 7. So I guess, we receive referrals from our partners, from family physicians, and from individuals and families. So we really try to keep that open as much as we can.
You talked about the numbers going up, and I think we're seeing this with a number of different services. The issues are more complex. There's more folks that are needing to access services, and yet there's still this stigma with mental health. What are you doing as an organization to help to break down the stigma? What are some of your health promotions or your campaigns?
So we launched the Soul Focus Project in 2017, which was very much around addressing stigma. And through that project, we have now, hundreds of ambassadors or some strategic partners. And really, the message has been that mental health is health. And if you had a broken arm, you'd go get support or help for that. And if you have any mental health issue, and we all do at any given point in time, then it's okay to reach out and access support. And it's interesting because the younger generation, those in their teens and 20s, they are a lot more literate when it comes to their mental health. They really don't have an issue saying, I'm feeling anxious today, or I have stress. Like, they just know the verbiage, and they've grown up in that environment, which is a good thing. But then on the flip side, we still have, some different communities or groups. So we might say middle-aged men, for example, are less prone to reach out when the needs present themselves. Or those in agricultural work, or first responders. So through our Soul Focus Project initiative and our work in health promotion, we've really tried to reach out in a proactive manner to some of those populations. And it's about building trust and, just letting them know that we're there. We've really gone about meeting people where they're at. So we work with migrant workers, but we go to the farms, right? We make it very easy for them, because someone might say, oh yeah, I'm feeling, X, but then that still requires the phone call, or you might get a voicemail when you do pick up the phone. So by being present, we found that that has really helped move the needle. Interestingly, while we think, there has been great strides for mental health stigma, and that's also in thanks to campaigns like Bell Let's Talk and lots of other corporations wrapping their hands around mental health, there's still a significant stigma when it comes to addictions, is what we're seeing, right? That is kind of the next hurdle, that no one wants to talk about that. It doesn't happen with me or in my home. So we're seeing that piece. And interestingly, we still see some stigma as it relates to grief and grieving, right? That you lose someone and everyone's very supportive for those first few weeks and such. But then it becomes uncomfortable to have those conversations longer term. So I think, that's just a North American philosophy as it relates to death and dying. But we could do some more work around there. But I think the good news is that as it relates to mental health stigma, we are seeing shifts.
Yeah, and we hope that in doing this podcast, it's just another vehicle to get that message out.
Exactly.
That we're all in this together, and we're all experiencing, particularly since COVID, there's more of us experiencing it. And sometimes we don't think about what that's like until we're in it.
Yeah, and I was just going to say, I think the pandemic was a wake-up call for a lot of people, that you didn't know how important it was to have good mental health, with until then, and going through some of those uncertain times where you couldn't see your family, you couldn't see your friends, you were working at home in your, bedroom. Just that sense of isolation and lack of connection impacts your mental health. And I think we all had days during that period that put it front and center for us.
For sure.
Yeah, and I think when you look at the big picture, there's no individual, no couple, any relationship that has all the same issues, the same dynamics to it. So there's no one solution or one-stop shop for those experiencing mental health challenges. So you've already talked about this a bit, but I guess if you can elaborate on it a little bit more, are there key community partners that you work with to help CMHA to better support those in need who access your services?
100%. And I think as an organization, that's one of the things we're most proud of are our partnerships, and also one of the things that helps make us successful. Like you said, it's a huge issue, and the numbers are growing, and no one organization can do it alone, nor should they. We all have our, lanes where we have different areas of expertise. So we have a lot of partners. So all the hospitals we work with in some way, shape, or form, post-secondary institutions. So, the college, the university we work closely with, the city. So City of Windsor actually employs a couple of CMHA therapists, counselors to support, one of their programs. We have Workforce Windsor-Essex, Family Services Windsor-Essex. It's just numerous, and those are all part of the puzzle in helping to provide these vast supports.
Yeah, and I think people that are suffering from mental health, it's difficult. It's a difficult time for them. It's challenging, and they're dealing with these specific issues. So they need an advocate. They need somebody that will be there for them, uphold them, stand up for who they are. So having said that, where is CMHA in the sense of, I guess, putting advocacy as a priority and bringing that forth for the clients that you serve?
Yeah, you're exactly, spot on about that. Advocacy is actually part of our mission statement. So we say we are the lead provider and advocate for specialized community mental health services. And, two of our values are compassion and being person-centered. So we very much recognize that, some people might be in a state where they're not equipped to advocate for themselves. So we like to think that we give voice to those who are unable to advocate for themselves, and just, help guide them and in their mission and in their journey of mental health. It shouldn't be, how shall I say, there's ways to, it's an illness like anything else, and there's ways to lead a very fulsome, wholesome quality of life, even if you have a mental illness. There's no reason why that shouldn't happen, but you need the appropriate supports around you, and we're part of that solution.
As an extension of that question, what's the collective message that we want this community to send to government about adult mental health services and supports?
Well, mental health and addictions has been an underfunded piece of the healthcare puzzle for years. So compared to the investments that primary healthcare might have received, for example, we have received very, very few cost of living increases. We received 5% last year, which we were very grateful for, but that was the first significant one in probably over a decade. And as we all know, when we go to fill up our gas tanks or buy groceries, the cost of living is growing and increasing rapidly. So I would just, call on government to ensure that we receive those annual increases, especially to base budgets, because that's where we can really benefit. Our bills are going up just the same. We have, we're a unionized environment. So, we have wages that go up a grid. And these are important services. And it's not a time to be cutting. It's a time to be investing as it relates to mental health. So that's what we would, we're always, saying to our government friends that, we're grateful for what you give, but we need more.
In addition to that government funding, how else is CMHA bringing in the dollars to cover all the programs that you're doing?
Well, we live in a very generous community, and we're very grateful for that. So our fundraising has been successful over the last, several years, and that's wonderful. So certainly through any form of charitable giving, whether that's an event or mailing in a donation or applying for grants and sponsorship. So that has been a growing piece, and then some of more untraditional ministries. So, for example, the Solicitor General had a program under the RCMP that had to do with trafficking, and we were able to apply and were successful receiving that grant for the Youth Hub. So I think it's thinking outside the box in these financial times of, different avenues that may not have been historical, but so the bulk is still the Ministry of Health, but we do fund a number of programs and positions now through our philanthropy, and then some other opportunities as they're appropriate.
What is your call to action for the community in terms of fundraising? Are you looking for individual donors? We often think about the big pots of money, but can individuals in our community support the work that you do?
Absolutely. I think that's a really important piece, right? That, we have been fortunate to receive some, lots of gifts from those corporations, but individually, if everyone gave a little, it adds up to a lot.
Buy a ticket to an event.
Yeah, we have several things coming up. May is Mental Health Month. It's like every other day, some kind of event or activity. A lot of them raise funds for our programs. And then in June, we have our signature events, our golf tournament and Ride Don't Hide. And collectively, those are, significant fundraisers that, support our programs. And we try to have something that would appeal to anyone, because we know mental health affects everyone. So when we do these different fundraising activities, we really do try to make it so that, if you have $20 and you want to support us, we are most grateful, and, we welcome that. And it goes, it stays local and really does make these programs accessible and sustainable.
And where can our listeners find you, find out more about your events?
The easiest way is our website, windsor-essex.cmha.ca. And then we're, of course, on Facebook, Instagram, X, LinkedIn, and the handle is at CMHA WECB.
Great.
Okay. Kim, any final thoughts on how we can all work together to support these individuals and families?
The theme for Mental Health Month this year is compassion. And I think today it's easy to be vocal behind a keyboard or even in your daily travels. But we all are on a journey. You don't know what someone is dealing with, in the background. So I think just the message to be kind and compassionate, especially in the world we're living in, goes a long way, and that everyone has mental health. And, sometimes those, there are those that are going through an especially difficult time, and just, I think, be understanding, don't be judgmental, and, know that on any given day that could be you. So I just think compassion and kindness go a long way in our world.
Absolutely. Great message. Mm-hmm.
Well, I want to thank you for being with us today.
Thank you.
I think, our community has learned a lot, but at the same time, as you just mentioned, all of us at some time in our life will probably be impacted by some sort of mental health concern, or we will know of somebody that does. So it's great to know there's an organization such as CMHA that is here that people can call upon when they need them. And like I said, or like you said so well, just be kind, be compassionate, and really respect each other. And that goes a long way.
Sure does.
So thank you, Kim, for being with us today.
Thank you.
Thank you, everyone, for joining us on Inspiring Community, and we'll talk to you next time.